Well, greetings again. This is Dr. Bill White with the American Orthodontic Society, and I want to talk to you a little bit more about ankylosis, but really I want to just go into studying the teeth and the roots and the bone structure that they're in, and just kind of give you an overview of what this is, what we move around and what we do to change the orthodontics and make people look better, and does a lot of things for them. So let's know a little bit more about this root structure and the bone they're in and what you can do with it. And let's get started on that right quick, and I don't want to take too much time on it, but touch that. Now this is a jaw of an actual person, and this has been cut down fantastically. If you look close, you'll see a little line right down through here, and that's one chip the tooth broke off right there. And this is hinged back here, and it has a latch up here, and you undo it, and you can fold this part back and look at it and see what it is. Now this is no plastic skull. This is an actual thing. I wish that we had not signed off on that and they gave everybody an actual skull to work on. It's just so much more complicated and so much better to look at that. Now let's just open this door up for a while, and we'll see. There it is with that erased. And let's, let me see if I can change this now. I'm going to go back. And we've got to change this still. I'm going to pause for a minute. Okay, we're back again, and we'll see if we can do a little better here. I'm opening this thing up. Push that handle down over there. Let me see. I thought it was back. Now, you push the handle down, and this has been cut off so delicately. I don't see how preparing this they did this, and I'm so proud to have owned this all my career. And I bought it back years ago when you could get the actual skulls back here. Now this is cortical bone right in here, this fibrous part of the bone. And this cortical bone has the harder cancellous bone on top of it, in between the teeth. And then this bone in here is cancellous bone, all this right here. And if you want one of these pins to really hold up, you got to come through some of this cortical bone and put the pin in, and yet, in the cancellous bone, it'll hold it to some extent, but it holds much, much better in cortical bone. Now you've got to drill a tiny hole through the cortical bone that's just slightly smaller than the screw that you're going to put in there, so that the rings of the screw fit in there and press out into the bone structure to hold that screw in place. Now, you've got, if we take something like this and look at it real close, the bone structure is on the edge of the bone structure, and between the tooth is a cementum, and there's a periodontal membrane in between the bone, and you see a little opening right there. this periodontal membrane is just thousands of little elastic thread-like things. Here's an opening right here. See, it shows you more. That goes into the bone structure and also into the root itself, right in here. So this is where your periodontal membrane is. Now this is what, if you get a blow on this tooth and something hits it hard, let me get my arrow back over there. And if you get a blow on this tooth real hard, going in this direction, see, and it prizes that root, or it forces it, or if you hit it over here, and it forces this together and squishes the periodontal membrane, which is just gingers or little fibers going out of the root of the tooth into the bone structure. So the tooth's got a little give to it. You bite on it and hit it hard, it's kind of give just slightly with this periodontal membrane, so it supports it like that. Well, if you press or hits that real hard and you damage the blood supply to the periodontal membrane, then it'll of course bleed, and then the bleeding, sometimes the bleed will just unite the root of the tooth and the bone structure will just grow together. And then there you've got an ankylosed part of that tooth. And you cannot move that tooth unless you break that loose. So sometimes we have a real hard breaking it loose. Sometimes it's just a very small area where it's grown together. You break it loose, and then you can move the tooth like normal. But I found out you can break them loose. Don't stop moving them until you get them where you want them to go. And then if it goes back together again, you got a good anchorage point there. But that's what ankylosis is, where the root has been jammed up against the bone structure that it's in and crushed the little periodontal membrane and busted the blood vessels in it. And then the bleeding of that, the bone can form with that blood clot and grow the root of the tooth and be attached to the bone structure. And then that tooth won't move unless you go in and move it and break that bone structure again, and now keep the tooth moving to get it where you want to, because it may ankylose again. So this is what we wanted you to know about bone structure. And I mean the real detail, it's more complicated than that. This cancellous part of the bone where blood forms and all sorts of things in the body takes place in the bone marrow. See, that's in this part. And you go into it, you move it. Now, I'm going to go through these pictures a little bit further. We're going to open this gate right here. We'll bring it out somewhere like that. And now we're looking at cancellous bone and where the nerve canal goes down through here. And then you'll have nerves going up in blood vessels. You have an artery, a vein, and a lymph node going into each of these roots right here. And they do that on this skull. I'll kind of show you that. I won't go into that now. But they got a saw in there, small enough, thin enough to cut that hard bone. And this cancellous bone is really hard and tough. And it's a shell around the tooth. When I've gone in with the surgeons and where they section the tooth and lengthen the jaw or shorten, they'll cut down on one side here and then go over on the other side and cut down in another spot, and they'll crack that loose, and then they can slide these sections apart and screw them together, and bone will fill back in. Now they would can't slide enough, they stretch this nerve around here, and the nerve comes in, has an opening in here. It's a fabulously made body. I mean, it is. I can't say how wonderful it is. And we use this for years. I've been using mine now for the time I was born, was conceived, 95, was going on 96 years, and even the cartilage in between, not cartilage, the dense connective tissue that makes up the disc before it takes the blow, it's still functioning good on me. Excuse me. I'm having a cough here. Now let's go on to another picture of this. There's up a little bit closer where we ended out. That's closer. You could get some idea of where your nerve endings go up into the roots. And when you do a root canal filling, you got to clean all that out down in there, and you go in and open this up where you get your files down in here and clean this out and everything. This part of the tooth is still alive, you see, and you can move a tooth with the root canal almost like you can without. I think it is. I never pay much attention. They just move the whole thing all together. I try to move a group of teeth together rather than one tooth, and then bring the next tooth. Just take the whole bunch and just gradually put force on them, and the body picks these up and changes this bone, and you can just move this whole group of tooth around here. Or you can have this tooth missed. You can have something go wrong with it. Kids don't brush them good when they're young, so a lot of the 6-year molars are rotted out, and they'll have wisdom teeth. And it's so much better to bring this tooth up here, and you can carry this tooth up here parallel like this. I mean, bring the roots with the bone when you're doing that. Let me kind of give you a little idea of how you do that. You know, you've got your arch wires coming in here like this, and then you're going to have to put a kind of a loop in it about the center where you want this to go. You come down and push it, the loop in like this, and then you drop this low down. Now you bring this wire up here and put it through a tube on this side, and it's got force. If you didn't have this, it would move these two teeth down like that, you see. Now you tie your arch wire on the other side of the mouth and have it do it. If you just use one side, tie it up, and now you can come in here and go to the back of this, to the back of where you push this in, and put a lot of force on it. If you put too much force, the tooth will lean this way. If you have about the right size, the tooth will move forward bodily. I mean, you take this tooth and move it right over here where this tooth is by having this wire activated. It'll bring that back. If you don't pull tight enough, the roots will get ahead of the crown, and you can see what's going on here, and you increase the pressure to move it. As soon as it gets up, see, this tooth will move over here. You move this loop back further, and it'll bring it right up against this bicuspid. You can take this tooth and put it right up against the bicuspid right there, and I'll tell you, 9 out of 10 dentists won't know the difference. That this will be a second molar in the wisdom tooth. They'll think it's a 6-year molar and a 12-year molar, and somebody took the wisdom tooth out. You can't tell the difference in it. Now, people always, they write and ask questions about it. I wish I could actually see who I'm talking to, and I could answer these questions while you're there and everything. But actually, there will know how long it takes you to move this tooth over here where this one is removed. It's gone, and we're going to tear this one over here. Well, if we see a rotten tooth right here, whatever it did, we would get the orthodontic stuff on there to start with and come in and that day take this tooth out. I mean, just move it. And now we will put this loop in there with this pressure on it and tie it and bring this arch wire back over to the other side. It's got to be tied on to both sides and just start pulling that in there. And you can put this tooth in here before you let the cortical bone fold up inside there. Don't say, well, I'm going to be safe. I'm going to sit around here and I'm going to wait a couple of months before I do this. You add about twice the length it'll take you to get the tooth over there. You ought to start moving it the day you take the tooth out, because the cortical bone will start to fold together over there. And if you leave it very long, or at least take where you've got a bridge in here, and your bridge has been there for years, and you take the bridge out, you want to pull these teeth together, then you've got a knife edge ridge in this area, and that's hard to move. In other words, this hard cortical bone, you're trying to move this tooth through that bone. It will actually bring its own bone structure with it as it comes together, and you'll have a little kind of indentation of the tissue right there. But you can move teeth into knife edge bone structure, but it takes a lot longer to do that than it does if you start moving them the day you extract the tooth, or not later than the next day or two, or try to get it immediate if you do it. Just put some gauze in there, get them stop bleeding, and start moving that tooth in there that very day. And that'll be the shortest visit. You can have those teeth moved in there in a matter of probably, I guess at 2 or 3 months, you can have them pretty well in there. You'll see them halfway or 2/3 of the way through there. Do that. If you don't want these to move back, now go in this cortical bone, drill a little hole, put a screw down in there, and then bond that screw to this tooth right here, and it can't move, or it won't move with that in there. And it is ridiculous the price they charge for these TADs, they call them. You don't take the screw out, so you just use stainless steel, and you can make a whole bucket full of them for the price they charge for them. So you can have the tooth made and hold that tooth right there with a stainless steel screw. When this tooth gets up there, you bond this, just bond it to it, then you take that thing out, and you can finish closing it with a little elastic or something of that nature if you haven't got it quite up there. So I want to see people doing this, replacing 6-year molars with 2nd and 3rd molars. It's something that ought to be taught in every cotton-picking dental school in the country. They ought to teach that. I mean, that is no real reason why we shouldn't have dentists know that. And they don't know it, and they don't even know how to upright a tooth that's sitting in here like this. You can upright any tooth on anybody at any age there is. And they don't have to be in braces or anything else. You can upright teeth in there. And you can upright them and pull them up again in closed spaces. And they were just tied that by bonding a wire on a few teeth out here. I hope that we get that across. I don't want to be too dogmatic or whatever you want to call me, but that just bothers me that in the dental schools, people are not telling people what they can do orthodontically. That will change the diagnosis on so many things. You can do restorative dentistry with orthodontics. I mean, you can bring these teeth back up there, and they're far, far, far better than implants or bridges or anything else you can put in there. And that tooth can last you all your life. So I'll get off that's I carry on like this. I don't mean to make the orthodontist mad or the people, but that's what we ought to be teaching. Dentists come out of dental school, they don't have any foggy idea how to do that. I've taught so many young dentists how to do orthodontics, and they don't need to do a whole lot. But especially if they're working on kids, they ought to know a whole bunch of things on kids and be able to do it, really. So you're not going to send them over to the orthodontist every time they need a little something done orthodontically and have an ectopically erupted tooth or something of that nature. So let me get on here and finish this video out. Now we're down here where we could now show just the whole thing setting like that. And I don't know whether I've got it or not here, but I thought we had, this is showing the nerves and the going up into the root structure of the teeth, and this is the cancellous bone. Now you can just, if you make a hole through the cortical bone, you could go into cancellous bone real easy with these tads. But you need some cortical bone to really hold. Sorry. Okay. Now, here is a tooth that has been removed. I mean, just slipped it out of that area. And this is the cortical bone right here. The day you pull the tooth, I don't care who you are or what you do or what else you're doing here, this bone, your body doesn't need it sticking out there, and it starts going in this way. And if you leave it alone long enough or bridge it and leave it for months and months, this will actually, these two groups of bone will come together in here kind of like this, and you will have a what we call a knife edge ridge of bone. You'll have bone that just kind of comes up like this. It comes down and in between those teeth. And I've heard people say, well, you can't move a tooth into cancellous, knife edge ridge of bone, but you can. It just takes time. And the bone structure on each tooth will just go along with it as it comes together. And when you get them together, you'll have a little kind of a little V-shaped dimple in the tissue there, but you can move them in there. So I've taken a good bit longer than I wanted to. This is nighttime, and I hope that we show you what you can do orthodontically. You can do a lot of restorative dentistry orthodontically, and people would do it. There are adults out here all over the world that would like to have their teeth straightened up some. And you can do it, and you can work on somebody's teeth as long as they live. You can move them. I've done people up into 90 years of age. I didn't start them when they were 90, but if I'd had somebody that wanted to come in and do it, I would have done it. But I've had people in their late 80s that went into their 90s before we got them finished, and it went the same. And I could have my teeth straightened today if they wanted to go through orthodontics. I've got good bone structure around the ones I have. I lost 2 molars, and I wished I'd have kept them. Boy, keep your own teeth, have a root canals done when you need to. And so I'm going to sign off tonight before I heck everybody else just listening to these videos. We have a bunch of wonderful people out there that's signed up. We got over 5,000 subscribers, and this comes up to you, every one of you. And if you haven't subscribed to these channels we got, I'm on the Facebook and everything you look. The people have helped me put me in lots of different places, Instagram and all this, but mainly it's YouTube that we're using. And so I hope you learned something, and I hope that everybody in the world will learn what can be done with their teeth. And thank you, and I'm going to say goodbye and close out. And I love people, and I hate to see somebody suffering with a joint problem. It's just absolutely ridiculous. You can do so much to stop that problem, and more people have problems with it than you think. And so I'm going to close off and say goodbye. If I can get over here to this deal.